Hi, I'm Matthew Maynard. I'm the Provincial Coordinator of Hemophilia Ontario, and it's my pleasure to introduce Dr. Jerry Teitel, the Medical Director of St. Michael's Hospital, Hemophilia Program.
Thank you, Matthew, and thank you everyone for your interest in this presentation. And what I'm going to do in the next little while is give you an introduction to Xyntha so you have some familiarity with one of the products we're now using in Canada to treat hemophilia A. First, I'd like to make you aware that this presentation is on behalf of Pfizer, which I'm doing as a courtesy to the hemophilia community. And as you can see, Pfizer is providing me with an honorarium, and they were very helpful in some of the technical information for this presentation, but Pfizer had no involvement in its preparation. So, what is the goal of this? The Canadian Blood Services, the CBS, has signed contracts which have changed the factor VIII concentrates that are available in the regular inventory for Canadians with hemophilia A. So Xyntha, the product we're talking about today, is now available in large quantities. Advate, which some of you are well familiar with, will no longer be available. And the other products which are available in varying quantities are Kovaltry, Eloctate, and Nuvec. So the purpose of today's presentation is to familiarize you with the characteristics of Xyntha. So first, what is Xyntha? So Xyntha is an unmodified, B-domain deleted, recombinant factor VIII concentrate. So let's unpack that sentence a little bit to make sure you understand what I'm saying. So first of all, recombinant means that the factor VIII in Xyntha is produced in cell cultures. It is not derived from human plasma. B-domain deleted, the B-domain is a portion of the factor VIII molecule that doesn't alter its function, and the factor VIII in Xyntha is expressed without the B-domain. By unmodified, what I mean is that the factor VIII molecule is not altered in any way and nothing is added to it, which is different from some of the other products which are now becoming available. So a few facts about Xyntha. First of all, this product is approved by Health Canada for the treatment and prevention, that is prophylaxis, of bleeding in both adult and pediatric patients, so adults and children of all ages with hemophilia A. The structure and the in vitro, that means the outside the body, functional characteristics of Xyntha are comparable to those of natural factor VIII. Some of you may remember a product called Refacto, which is one of the earliest recombinant factor VIII concentrates, and Xyntha is actually the successor to Refacto. And in fact, in some countries in Europe, Xyntha is known as Refacto AF. And although not relevant to hemophilia A, you should know that Pfizer, which is the manufacturer of Xyntha, also produces Benefix, which is the most widely used product in Canada for people with hemophilia B. So what about the characteristics of Xyntha? So as I said earlier, Xyntha does not contain the part of the factor VIII molecule called the B-domain, which has no known function in circulating factor VIII, and I'll show you that in a few moments. Xyntha is not an extended half-life factor VIII concentrate. I'm sure many of you have heard the term extended half-life products. Xyntha is not an extended half-life concentrate. It is derived from factor VIII secreted by a hamster cell line called CHO, which is a cell line which has been around for many years and has been used to produce many recombinant protein products. It's a well-recognized, well-characterized cell line. It's free of any detectable viruses. Xyntha has been approved in the USA, in Canada, and in Europe, or as I said, it's known as Refacto AF, since around 2008-2009, and it has been extensively used since then in both Europe and North America, and in fact it is the most widely used factor VIII concentrate in Quebec. So a few facts about the production of Xyntha. Xyntha is described as a third-generation concentrate, which means that no human or animal products are used in its production or its formulation. And because of this, it is inherently free from the risk of transmission of human blood-borne pathogens, that is, infectious agents such as HIV, hepatitis viruses, and parvovirus. And to further enhance the viral safety and to provide reassurance to the community, which of course has suffered a great deal in the past from viral infections, a solvent detergent viral inactivation step, and a virus-retaining nanofiltration step, and I'll show you these in a few moments, are included during the purification. So what does Xyntha look like? This is a cartoon of the structure of factor VIII, and on the left you see full-length factor VIII that includes that B domain shown in the blue on the upper part, which is the heavy chain of factor VIII. And B domain deleted factor VIII, the factor VIII in Xyntha, is shown on the right, and you can see it lacks that B domain. But why is this not important? Well, factor VIII circulates in the form shown here, but when it actually does its job in coagulation, it has to be activated. And when it's activated, it looks like this. The B domain is removed, even from full-length factor VIII. So whether it's produced with or without the B domain is irrelevant to its function. Now this slide's a little complicated, and I don't want to go through it all, but I just want to make a few points about the manufacturing of Xyntha and the modifications that have been introduced into its manufacturing to enhance safety. And that means modifications from the previous generation, rather, of Refacto. So first of all, on the left, you can see media where it says there's no albumin in the culture medium. So there is no human albumin anywhere in the production, even going back to the stage of the cell cultures. The purple box on the right that says ligand, a ligand is a molecule which captures the factor VIII during its purification. And many of the products that are used to produce factor VIII and factor IX use as this ligand a mouse antibody, which introduces a small but rare possibility of sensitization to mouse proteins. Xyntha does not use mouse antibodies in purification. It uses a molecule which is not derived from any animal product. And finally, this nanofiltration, or very fine filtration step, is used to remove any viruses which might somehow find their way into the product. So it's kind of, again, summarized on this slide. I won't go through the details, but you can see that factor VIII is grown in an albumin-free culture. Then there's a solvent detergent step, which literally disrupts viruses that have a fatty coat. Then there's the capture of factor VIII, which does not rely on a mouse antibody. And finally, we have the nanofiltration. Now, this is a picture of the way that Xyntha is presented, and I'm not going to go over this because Georgina, in her presentation that follows this, is going to show you in detail how Xyntha is presented and reconstituted. So instead, I'm going to go on now to talk about the clinical studies that led to the approval of Xyntha in Canada, to give you an idea of the work that was done to demonstrate to Health Canada that this product was safe and effective and should be introduced into our armamentarium. So the first study I'm going to review is a study of previously treated patients, which are abbreviated as PTPs. So this is a study that was conducted in 10 countries, 24 sites. And the first phase of the study was pharmacokinetics, and many of you are familiar with that term. That means a study of how the factor VIII is handled in the body, how much of it is recovered when you inject it, and how long it lasts, and how it disappears from the circulation. So this was a randomized, blinded crossover design in previously treated patients with severe or moderately severe hemophilia. And the crossover means that the subjects in the study were given Xyntha and then Advate, or vice versa, to see how the PK characteristics of the two products compared. And Xyntha was, or rather Advate was chosen as the comparison because it's another very widely used factor VIII concentrate. And this was done in 30 people, which is a pretty good number for hemophilia. And then 6 months later, a follow-up PK study was done just to see how stable the pharmacokinetic characteristics of Xyntha were over time. So that was the pharmacokinetic phase. The next phase was safety and efficacy, and this involved 94 subjects, which is, again, a good number in hemophilia. And this was an open label use. In other words, the subjects knew they were using Xyntha, and they used it either for routine prophylaxis or a smaller number used it on demand. They weren't on prophylaxis. The prophylactic schedule was defined, and I'll show you that in a few moments. and they had a minimum of 50 treatment days or over a period of 6 months. And the on-demand subjects, that was something that was agreed with their clinic directors. So the main objectives of this study were to establish the pharmacokinetic equivalence with another product, Advate, and the primary safety objective was to determine the inhibitor safety of Xyntha. And as you know, the remaining major complication of factor VIII infusion therapy is the development of inhibitors, which means antibodies that interfere with factor VIII function. And there were a number of secondary objectives, which include the stability of PK over time, the efficacy in preventing and treating bleeding, adverse events other than inhibitor formation, and adherence of subjects to the regimens. So this is the first part of the study, and this shows the pharmacokinetics comparing Xyntha and Advate. And a picture is usually worth 1,000 words. So if you see the graph on the left, and that shows the injection of one dose of either Xyntha in blue or Advate in red, and then it shows how it disappears by measuring factor VIII concentrates over at various times up to 48 hours. And you can see that the curves very nearly overlap. They're very close, and in fact, statistically, they're identical. And what that means is that the two products, Xyntha and Advate, have essentially equivalent pharmacokinetics. And the numbers that attest to that are shown on the right. And those are some of the values we look at when we do pharmacokinetic studies. And if you look at the third line down that says half-life, that's one that many of you will be familiar with. And you can see that they both have half-lives around the 12-hour mark, which is what we expect from an unmodified factor VIII concentrate. And furthermore, the recovery, that is the amount that we can measure in the circulation after we inject it, was pretty much dead on what we expected based on the principles. And that is, as you can see, the in vivo recovery, and if you look at the last line, was a little over 100% of what was anticipated for both factor VIII products. So that was the first demonstration of the pharmacokinetic equivalence of Xyntha with another factor VIII concentrate. And then when the pharmacokinetics were repeated 6 months later, you can see the red line on the left, if you look at the graph, is the pharmacokinetic study in these patients at the start of the study, and the blue line is the same pharmacokinetic study done 6 months later, and those curves really are identical. Again, the numbers are on the right. We don't have to look at those because just looking at the curve, you can see that the pharmacokinetics are stable after 6 months. So what about the actual response to treatment? So if you look again at the study design, the subjects in this study received, as I said, either prophylaxis with on-demand for breakthrough bleeding or just an on-demand schedule. There were 94 patients in the study. They all received treatment during the study, and in the open label safety and efficacy period, all of them received Xyntha at a prophylactic dose, those who were on prophylaxis, at around 30 units per kilo 3 times a week. And if that was not effective enough, there was a provision to increase the intensity of prophylaxis. And if you look at the bottom part of the slide, you can see that the median age was 24 years, so these were young adults. They all had extensive exposure, over 150 previous exposure days, and they all had factor VIII levels at baseline of less than or equal to 2%. So here's a slide that shows the dosage pattern that was used, so 3 times a week, 30 units per kilo, 24 weeks, so that's about 6 months of treatment. And if you look at the fourth line down, you can see that almost half of patients, 46%, had no bleeding at all during the prophylaxis. So Xyntha in this study completely suppressed bleeding in 46% of individuals. And In fact, 61%, a little over 60% of them, had no spontaneous bleeds. In other words, many of the bleeds that did occur were caused by trauma or injury. And the annualized bleeding rate, which means if you average it out over a year, was 3.9. That's the average or mean. And the median, which means the halfway point, so half had above that and half had below that, the median annualized bleeding rate was around 2, just 1.9. And these are very good. Remember, these are heavily pretreated subjects who had lots of target joints and lots of risk of bleeding, and they bled very little during this study. This shows the treatment of bleeding episodes on demand, and if you just look at the chart on the left, you can see that about 3/4, 74%, resolved with a single dose of Advate, which is a good response and really what we expect. And 93%, the large majority, resolved with 1 or 2 doses. And the assessment, this is the individual's own assessment of the response to bleeding, a little over 70% judged the response excellent or good, and another 24% moderate or fair. Remember, these are people with established target joints, with bad joint disease. They have had a lot of bleeding over their 20-plus years of life. And on the right, the graph there shows the sites of infusion, or the sites of bleeding rather, and you can see that most of the bleeds were in joints, a smaller number in soft tissue or muscle, and other sites shown as well. Now, what about safety? So inhibitors, as I said, the major concern of treatment with factor VIII concentrate, we would not expect many inhibitors to develop because these are heavily pretreated patients. So there was a pre-specified inhibitor safety endpoint, and this was something that was figured out by the statisticians involved in the study. So they predetermined that a successful response would be no more than 2 inhibitors in at least 81 subjects tested. And that's based on what we know of the natural history of inhibitors from all the experience we've had over the years with hemophilia treatment. So what were the actual results? 2 of the subjects in this study had transient inhibitors. That means they came and then went, and they were low in titer. So they had inhibitors which only lasted briefly, which were low in concentration, and both of those 2 inhibitors was observed on only a single occasion and then went away. Neither of them interfered with the treatment response, so they could continue to be treated with Xyntha and get a good response. And as I said, they were transient, so the follow-up titers were negative. Sorry, there's a typo there. It should say follow-up titers were negative for each patient. So based on that, it was calculated that there's a 95% probability that the inhibitor rate is less than 4.17%. So that's just a statistical calculation, but the message here is that the primary safety endpoint was achieved. There was no unexpected development of inhibitors in these patients. What about other adverse reactions besides inhibitors? So really the bottom line is very little. The most frequently reported adverse reaction was headache in 24%. Whether or not that was related to Xyntha, who knows? And there were other adverse reactions, nausea, diarrhea, weakness, fever. These are things that may or may not have been related to Xyntha, but anything that does occur when you're on a study protocol like this has to be reported. No subjects developed antibodies to the CHO cells. Remember, those are the cells that produce the Xyntha, or to that small molecule ligand, remember, that I told you that traps the factor VIII. And the adverse reactions that were reported were all considered mild or moderate in severity. So in summary, the pharmacokinetic phase of the study showed that Xyntha and Advate have equivalent pharmacokinetic characteristics. The PK of Xyntha is stable over time. Xyntha is effective in the control and prevention of bleeding episodes. There was no evidence of new inhibitor risk or unexpected inhibitor risk in previously treated patients, and there were no additional safety signals. So the last study that I want to review briefly with you, which is something that is important to us, and that is the safety and efficacy in surgery in previously treated patients. We still do a lot of various kinds of surgery in people with hemophilia, and we have to be confident that the products we're introducing into the clinic are safe and effective in surgery. So this was an open-label, international multi-center study in patients with, again, severe or moderately severe hemophilia undergoing major surgery. So this is not small things like tooth extractions. These are major surgical procedures, and I'll show you what they were in a few moments. So this was open to people in whom we anticipated, or the study personnel anticipated, that they would need at least 6 days of treatment and monitoring postoperatively. So again, this is major surgery. And they could receive Xyntha either by bolus injection or by continuous infusion, which some of the sites in Canada use. So that was up to the discretion of the investigator. So 25 subjects were eligible for evaluation, which is a good number for a hemophilia surgery study. The median age was 35, and here are the operations. So there were 12 joint replacements, mostly knees, 5 synovectomies. A synovectomy is the removal of the lining of a joint to help prevent bleeding. And other surgeries that were done were hernia repairs, revisions of previous joint replacements, nerve surgery, ear surgery, ankle fusion, the removal of a pseudotumor, and arthroscopy, which means the cleaning out of a joint. So here's the effectiveness rating. So this is rated by the surgeon and by the hemophilia treatment specialist involved in the study. So at the day of surgery, 72% rated as excellent, 28% is good. So that adds up to 100%, so none of the results were less than good. And when reassessed at the end of the initial postoperative period, which means either 6 days or when the patient was discharged from hospital, 92% rated excellent, 8% good. Again, none of the results were less than excellent or good. And as far as blood loss, you can see that on the day of surgery, the surgeons and anesthesiologists involved both rated the amount of blood loss as being normal, no excessive blood loss. So in other words, it worked well at providing, at stopping bleeding. And postoperatively, in fact, 3 of the subjects were found to have what was called abnormal blood loss. That's 3 out of 25. And if you look at those 3, one of them was a surgical misadventure. There was damage to an artery, and that's why the patient bled. Another one was just a little more bleeding than anticipated after hip replacement, 800 milliliters of blood, which is more than is anticipated after hip surgery. We don't know why that occurred. And another one, there was a feeling by the surgeon that after the synovectomy, the patient had more bleeding than anticipated, but it couldn't be really counted because it was just absorbed into the dressing. As far as adverse events, again, there was one transient low titer inhibitor, less than 1 Bethesda unit. That's a very low titer inhibitor. The individual, the patient in this case, didn't have any symptoms. In other words, the Xyntha still worked, and they didn't even know about that positive inhibitor assay until later. So treatment continued and was successful despite the fact that in retrospect they found that there had been a low titer inhibitor. And the efficacy of Xyntha, in fact, in that operation was rated as excellent immediately after surgery and also at the time of discharge. So, sorry about that, and we'll go on finally to summarize the surgery study. So the efficacy during surgery, to reiterate, was excellent or good for all the subjects. And at the end of the initial postoperative period, 92%, the large majority, were rated as excellent, and the rest rated as good. There was one clinically silent inhibitor in one patient, and also, I didn't show you, there was a transient false positive inhibitor in one patient. In other words, that was a lab problem. no additional safety signals. So based on the results, Xyntha then is safe and effective for the perioperative, that is the surgical management of people with hemophilia A. So finally, a couple of slides just to end, and that's to show some real-world experience after Xyntha was introduced into clinical use. So these are two observational studies done in Europe, one in the United Kingdom and one in France, which is a study just to look at the safety of Xyntha with respect to inhibitor development. And both of those observational studies, large studies done in two major European countries, showed that Xyntha had a similar inhibitor profile to Advate in previously untreated patients. So these are not PTPs, as I showed you in these studies, but these are previously untreated patients, or PUPs, people who are more at risk of inhibitors. And what they demonstrated, or what they found in analyzing, looking back at their population, was that Xyntha showed a similar inhibitor profile to Advate, again, a widely used product for many years during these observational studies. So that's reassuring. And we've also had some interesting experience with switches, as we're doing now in most of Canada, by introducing a large amount of Xyntha to people who haven't used it in the past. So a question which at least theoretically arises is there a risk of inhibitor development after switching from another product to Xyntha? Well, there is experience to help guide us in that. And you can see on the left, this is a paper again from the United Kingdom, where they made a major switch to Xyntha in the UK, and they've published their data which showed, and I quote, "Our data provided no evidence that switching, and particularly switching to Refacto AF, remember, which is what the same product that we call Xyntha, no evidence that switching to Refacto AF increased the risk of inhibitor development." So that's reassuring. And the other major switch, and I referred to this earlier, was in Quebec, where almost all the hemophilia A patients in Quebec switched from a different product, Cogenate or Helixate, to, or Advate, to Xyntha. And although those data haven't been published yet, we know from our Quebec colleagues and from the safety surveillance database in Canada that they haven't seen any excess in inhibitor development. Thank you for your attention, and I'm now going to turn it over to Georgina, who's going to show you the presentation and reconstitution of Xyntha.
We're going to go over the steps for reconstitution of Xyntha Solifuse. First, ideally, you'd bring Xyntha to room temperature. Assemble all the supplies you need for reconstitution, your kit, and go and wash your hands. Remove everything from the kit and lay it out on a clean surface. Begin by inserting the rod of the syringe in and turning it till you feel it tighten up. You're going to remove the cap, just break it off, a little bit of a back and forth motion. You're going to remove the little gray cap and discard, and then you're going to attach the blue vented end. And you're going to depress the plunger slowly until the water or diluent mixes with the factor. And the two parts of this plunger, the two gray parts, will meet in the middle. Once you've mixed the water and the factor together, you're going to just swirl it gently. Don't tip it upside down, but just make sure that all the factor is blended nicely. And as we remind you, the product should look clear to maybe slightly cloudy, but should not have any bits floating in it. If it does, you wouldn't use the factor, you would notify the clinic. Then I want you to just continue to push a little bit of the air out. Not everything, but almost everything, till about there. Then, if you're only mixing one vial, you disconnect the blue cap and you'd attach your butterfly needle that's provided in the kit with a twist, and you would begin preparation for infusion as we've taught you in clinic. So now we'll go over the steps of reconstituting Xyntha using the R2 kit, and this is for vial sizes of 250 IU and 500 IU. So again, ideally you'd remove the Xyntha from the fridge and let it warm to room temperature if you've had it in the fridge. You'd lay out your factor, you'd go and wash your hands, and you'd come back, remove the various product pieces from the box, and I begin by assembling the syringe, just by twisting in till it's tight. Then you're going to remove the cap of the vial of factor, and you're going to take one of the alcohol swabs and swab completely the top of the vial. Then you're going to take the vial adapter. You're going to remove the paper, but don't take the vial adapter out of the plastic. You're going to keep it in there so it remains sterile, and avoid touching the tip of the vial adapter and now the cleaned vial. You're going to place the vial adapter straight onto the vial and press down, and as you know, I'm working on a flat surface, and that's key. Remove the little hat, as we call it, the vial adapter plastic, and now you're going to take the syringe. You're going to snap the end off. It's just a back and forth motion, and again, avoid touching the tip of the syringe. You're going to screw the syringe into the vial adapter, just in a clockwise manner, and when you'll see it'll stop turning. Now you're going to depress the diluent into the vial of factor, like that. You're going to mix the factor with the diluent, ensuring that all of the factor is mixed. I like to tip it upside down to make sure you get the factor that's stuck around the rubber stopper. Once the product is nicely mixed, you're going to invert and pull down on the plunger, and this will bring the factor that's now been mixed back into the same syringe. And when you've completely emptied the vial, you can then unscrew the vial from the syringe. And the next step is to take your butterfly needle, remove the end that's keeping it sterile, and attach your syringe to the butterfly needle. At this point, you're ready to infuse your factor as per your Hemophilia Treatment Center's instructions. Now, these are the steps for mixing one Xyntha Solifuse and one Xyntha R2 kit in the event that you need to mix two different strengths of factor. So reconstitute the factor according to how it's just been demonstrated, and you'll have your Xyntha Solifuse with the factor ready to go and the R2 kit. You will need a separate bigger syringe, either a 10 or a 20 cc syringe, depending on the amount of factor vials you need to mix. You will get this syringe from your Hemophilia Treatment Center. So after you've mixed both products separately, you're going to remove the syringe from the Xyntha R2 kit, and you're going to attach the Xyntha Solifuse syringe to the R2 kit. And then you're going to put into the vial the Xyntha that's in the syringe, just slowly like that till it's all in. Then you're going to remove this syringe, and you're going to attach the bigger syringe to the vial adapter. You're going to invert the vial, and you're going to pull back on the plunger to fill the syringe with the factor. Now you have both the Xyntha R2 and the Xyntha Solifuse in the same vial. And as you can see, this can take a minute or two to get all the factor down. And when you're sure you've got everything, you'll twist off the vial adapter. You'll remove the excess air from the syringe. And you'll proceed by attaching your butterfly needle. And continue according to the steps outlined by your Hemophilia Treatment Center. Again, that's how you will reconstitute and combine an R2, and a solifuse. So in the event that you need to mix 2 Xyntha solifuses together, so you have 2 vials and you need to combine them to administer, you would reconstitute each Xyntha solifuse as per the instructions. And you're going to need a bigger syringe that you'll get from your Hemophilia Treatment Center, and you will also need the red adapter that you can get from your Hemophilia Treatment Center. What you're going to do is you're going to pick up one of the vials of solifuse and you're going to attach the red adapter to one side of the solifuse, and then you're going to attach the empty syringe to the other side of the red adapter. And you're going to then depress the Xyntha solifuse slowly, and it will force the factor into the empty syringe. Remove the empty Xyntha solifuse and attach the second to the adapter and repeat the process, just pressing the plunger so that the factor is forced into the empty, well, not empty anymore, but the big syringe. And when you can repeat that as many times as needed till all the factor is in the common syringe. When you're ready, twist off the red adapter, attach your butterfly needle, and administer your factor as per your Hemophilia Treatment Center's instructions.